What the Makoplasty has done is to take the best of computer navigation and combine that with imaging, computers, and robotics to allow us to have reproducible precision with each and every surgery. Most people think of a robot as something that you program to perform a task, but in the Makoplasty procedure, I think of it as a reverse robot. This robot does not do anything without my hand pushing it in a certain direction. The computer is programmed so that we will remove a certain amount of bone from the knee, from the surface of the femur and the tibia. The surgeon has his hand on the robotic burr. The robot will prevent me from burring too deep or going too far towards the front, backs, or either side. It will not let you color outside the line, so to speak. When a patient is scheduled for the Makoplasty procedure, they are first sent for a CAT scan. The CAT scan is where we take digital three-dimensional pictures of structures in our body. In this circumstance, we'll take several pictures of the hip, knee, and ankle. This information is then put into the computer. With that information, our Mako technician will have a general map of this patient, the anatomy of this knee, and can make a provisional template of what implants will be needed to fit this person the best. Intraoperatively, we add to this. We put computer arrays on the femur and on the tibia and take the leg throughout range of motion so that the computer can register the hip center of rotation and the mechanical axis of the limb. After that, we add to the data in the computer by mapping out certain locations throughout the knee. There will be several spots over the femur and tibia surfaces that we mark with a alignment array. It's just a little probe that we touch these areas. Once all that information is in the computer, we go back to that preoperative template and adjust the implants precisely to make sure that they move evenly and that the force between the femur and the tibia is the same throughout range of motion. The benefit, we hope, is in the long term, because we've always known that the better aligned your implants are, the longer they will last. And so with this robotic precision, we think that getting every partial knee aligned perfectly every time, that we would expect that they will last longer. Generally, patients require very minimal rehabilitation after this. The first day or so when you're in the hospital, we'd like to get you up with the help of a therapist to make sure someone doesn't fall to injure themselves. But once patients show that they can walk steadily on the leg, we can let them go home. Most have been going to outpatient therapy. At 2 weeks, patients are coming back walking fairly well, if not normal, for the most part. Referral depends more on your insurance than anything else. As long as your insurance doesn't require referral through your primary care, you can simply call and schedule an appointment. If your insurance requires that you go through your primary care physician, I'm sure they'd be happy to set up an appointment for you to have a consult regarding whether or not Makoplasty would be right for you.